The patient landscape is changing. It isn't difficult to see this with the push for price transparency, increase in telemedicine, and a shift toward value-based care. A big reason for these shifts is due to newer generations growing up. Different demographics prefer different healthcare experiences. Millennials are already causing a shift in the industry as it is, but as the oldest members of Generation Z are starting to make their way into the industrial world and make their own health decisions, more people are demanding this change. Hi everyone, I'm Matt Moneypenny, and today I'm going to go over what Millennials and Generation Z patients want in healthcare. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit the alert bell icon next to it as well, so that when we post new helpful content, you get notified. First, let's start by breaking down the existing generations within the workforce. The oldest working generation is called the silent generation. They are currently 75 to 92 years old, and believe it or not, make up only about 2% of the workforce since the majority of them are retired. Next are the baby boomers, who are 56 to 74 years old. They're moving toward retirement, but actually still make up about a quarter of the workforce. These two groups make up a majority of doctor appointments and are the highest users of traditional healthcare. Following the baby boomers is Generation X, also known as the latchkey generation. This group is 40 to 55 years old, with most members working full-time present day. Then we have Generation Y, known as the Millennials. They're 24 to 39 years old and make up about 1/3 of the workforce. Finally comes Generation Z, who some are calling the Zoomers. This generation doesn't have a definitive age range, but usually refers to those born between 1997 and 2012. They're around 8 to 23 years old, so the oldest members are now entering the workforce today. We'll just focus on the adults of Gen Z for this video, since the younger members aren't making their own health decisions just yet. So now that we've defined the different age brackets, let's go over what the younger generations value in their healthcare experience. Now, I already mentioned that the silent generation and baby boomers are the highest users of traditional forms of healthcare earlier, but they visit the doctor more than any other generation since they're aging and need more health services, which makes a lot of sense. But the younger generation's healthcare preferences differ so much from this. Gen Z and Millennials rarely visit the doctor. In fact, 45% of Gen Zers don't have a primary care physician. On average, 51% of Millennials visit the doctor less than once per year. They use healthcare the least out of all generations in today's entire workforce. This is because of what they value and how much they use technology. Gen Z is the first generation considered digital natives. They've been born with a smartphone in their hands. And what I mean by that, when I say that, is the internet has been around for their entire lives. Millennials, on the other hand, were growing up as the internet started to develop and started taking off. These generations use technology for just about everything, so healthcare is not an exception in their eyes. Both Gen Zers and Millennials want digital options for their healthcare. This includes access to their patient records, scheduling appointments, and chatting with medical professionals on something like social media. They don't have much time in their busy schedules for doctor's appointments, which is why they value telemedicine and virtual visits. They prioritize convenience since they're so used to a fast-paced and busy environment. Even though younger generations visit the doctor the least, they are most concerned with their overall health and wellness. That sounds like a contradiction, but this is because of the digital options and information they already have available to them, such as search engines, fitness trackers, and smartwatches. They take preventative care into their own hands. Besides convenience and digital offerings, the cost of healthcare is a big deciding factor for Millennials and Gen Z patients as well. They want price transparency, a variety of price options, and plans with high deductibles and lower premiums. Both of these generations grew up in an age where the consumer has the power. When they're deciding to purchase a product, they're reading blog posts, watching unboxing videos, and looking at product reviews. So due to their buying habits on the consumer side of things, they expect a similar experience for their healthcare as well. Thus, we've seen a huge push for price transparency. Hospitals must now publish their charges and rates for patients to view. Many organizations are developing their own tools for patients to find costs. While all generations can appreciate this, it's especially attractive to those younger people since they often avoid health services because of the costs associated with them. Gen Zers and Millennials also value emotional experiences. They don't usually make expert-driven decisions. Instead, they seek opinions from peers because they value feedback on their experiences, which I kind of touched on just a few seconds ago when I talked about price transparency. But with those generations, you also have to keep in mind review websites like Google Reviews because they aren't as brand faithful as older generations are, and just one negative encounter or comment from one of your patients from the past will cause them to reconsider visiting you entirely. Making time to go to the doctor is already an inconvenience in their eyes, but they want to make sure they're getting the care and experience when they do go. Younger generations are impacting the healthcare industry in so many ways because of what they value. With their busy schedules and constant use of technology, they demand convenience and digital options. They rarely make time to visit the doctor, especially since they're taking preventative care into their own hands. And just one bad experience or stress over prices will cause them to avoid scheduling an appointment altogether. This is why we've seen such a huge push for digital options in healthcare, price transparency, and value-based care as well. If you'd like to learn more about what different generations want in healthcare, reach out to eTactics. And you already made this far into the video, so you might as well like it, share it, and comment below.